Greetings, lupus warriors all around the world. Welcome to another video brought to you by the Loris Lupus and Support channel. And on today's video, we're going to be talking about lupus and fevers for unknown reasons. Stick with me. And so tonight's information is going to be coming from an article entitled Fever of Unknown Origins, FUO for short. This article was written by Dr. Graham Rogers, MD, and it was written on August 31st, 2018. So I just want to give fair credit where credit is due. And so did you know that having a fever for unknown reasons, it's a very common thing with lupus. Why? We don't know. And sometimes you may not even know that you're dealing with a fever. You may discover it by accident, such as you decide to randomly, take your temperature. And you look at the thermometer like, whoa, my temperature is a little elevated. Or a friend or a family member may touch you, give you a hug, and they may say, you feel a little bit, your body feels a little bit hotter than usual. You may want to check yourself. You may have a fever. And so tonight we're going to talk about that. But before we get into it, make sure that you like, subscribe, leave a comment, and share this video. So when we discuss fevers of an unknown origin, there are two types of fevers. There's a low grade and a high grade fever. A low grade fever is 100.4 Fahrenheit. A high grade fever is 103 Fahrenheit or above. And normally when, a person has a fever, it means that the body is trying to fight off something. In most cases, it's trying to fight off, an infection from a virus or a bacteria, a cold or something like that. That is normally what happens, when someone has a fever. But with lupus, the cause of the fever is the body trying to fight off inflammation that's taking place on the inside of the body. The body's trying to fight that off. And inflammation is basically the immune system trying to fight off whatever. And with lupus, it's trying to fight off all of the inflammation that's occurring inside of the body. So what is taking place in the body when it's dealing with the fever? There are a few things that's taking place. The body is trying to cool itself off by tightening up the blood vessels that flow to the skin and to the contracting muscles. And so that's why we get what we call fever and chills. When the body's, tightening up the blood vessels that goes to the skin and to the contracting muscles, we get the chills. And also it can cause us to have body aches. How many of you have been there with lupus where you get all achy? You wake up and you're experiencing a lot of muscle pain or body aches. You just feel achy all over. Well, that's what's happening inside of our bodies. According to the article by Dr. Graham Rogers, MD, other causes of fever for unknown reasons or unknown origin can also occur with rheumatoid arthritis and inflammatory bowel disease. But what can we do when we're experiencing a fever? What can we do to reduce the fever and take care of ourselves? Well, the first thing is that we can take a medication that's known as a pain reliever. And most of the time, doctors, they recommend Tylenol. NSAIDs are not highly recommended for people with lupus. Number 2, a cold compress on the face and the head. Number 3, make sure that you rest and drink plenty of liquids. Number 4, make sure that you dress lightly. Don't put on too many layers of clothes. And I know you may say that's hard to do because when you have a fever, you're going to also have the chill. So you're going to go from cold to hot, shivering cold. But you don't want to dress in too many layers. It's best, to have as less clothes on as possible, not to have too many blankets or comforters on top of you if you're lying in bed resting. Just try to dress as lightly as possible to allow the heat, to leave the body. And last but not least, in order to, lower your temperature, and treat a fever, you also want to reduce your room temperature. And so let's say if you're used to, let's say if it's wintertime and you keep your heater at between 69 and 70. Well, if you're dealing with a fever, you may want to lower that, as much as you can. Because with the added heat and then your body's, giving off heat and you have cover and you have the heater on, it's not going to allow, the heat to escape your body and to cool down. Okay? And so that's all I have for this video at this time. Let me know if you have experienced, fevers for an unknown reason, since you've been diagnosed with lupus. And let me just give you, just a disclaimer. I'm not a medical professional. And so if you are dealing with the fever and you don't know why, make sure to consult your physician and have it evaluated. Anytime you're dealing with a fever and it's a fever that's 103 or higher, and you've been dealing with it for a couple of days and you can't seem to get your temperature to lower, please have yourself evaluated by a medical professional. Okay? And so we've come to the end of this video. As I always say at the end of every video, there is life after lupus, and that God loves you, and he loves you with all of his heart, and he has a plan, a purpose, and a destiny for your life that involves you, yes, you, showing up as you. Take care of yourself, my friend. Stay strong, stay encouraged, stay blessed, and I will make sure to talk to you soon on the next video. Bye for now, my friends.